Here's an alarming statistic from Rob Moody's article, Profits in Pandemics. In the US, the 10 largest food companies control more than half of all food sales. Worldwide, this proportion is about 15% and rising rapidly. More than half of global soft drinks are produced by large transnational companies, mainly Coca-Cola and Pepsi-Cola, with 75% of world sales being processed food, whose largest manufacturers control more than a third of global market. The impact of these processed foods on your health is in question every time you consume a prepackaged snack or meal. As someone who works in the ER and sees countless sick patients, I can attest to the importance of diet and its impact on health. I have also worked in the Family Research Laboratory at Wayne State, which studies the impact of diet on low socioeconomic families with young children. It's deeply troubling to me to see so little attention given to this matter, and so I've done some research on this subject to pass along some important information. Human beings should not eat processed foods due to these foods' negative impact on a person's physical and mental health. We should work to reduce their presence on grocery store shelves as well. Today, I'll first discuss the negative impacts on human health created by the consumption of ultra-processed foods. Secondly, I will offer solutions and alternatives that can help you choose to consume less processed, more healthy foods, and also educate you on ways that you can change up what stores have on their shelves. To begin, Jay Dwyer, director of Francis Stern Nutrition Center, explains that ultra-processed foods make up over half the caloric intake for the average human being. And despite enrichment and fortification, their low in nutritional value contribute to over half of the daily intake of saturated fat and sodium and account for a whopping 3/4 of added sugar in the average diet. Since 2006, with obesity rates continually rising, non-communicable diseases related to chronic poor dietary choices have outgrown the prevalence of diseases caused by malnutrition. A longitudinal study done by Fernanda Rauber at the University of Brazil showed that 50% of preschool children's caloric intake came from ultra-processed foods, which resulted in a significant increased risk for elevated cholesterol in low socioeconomic status children as young as 8 years old. This marked them with precursors to cardiovascular disease as adults, which is the #1 cause of death in America. Robert Moody from the Nassau Institute of Global Health reveals that low-income and middle-income countries are most affected by increased consumption of ultra-processed foods and the subsequent paralleled increase of non-communicable diseases such as diabetes and obesity. Diets high in ultra-processed foods also negatively affect mental well-being. In Al Sherman's article, Processed Foods Linked with Depression, diets high in processed foods were shown to increase risk of depression by 58% compared with diets of low intake. Furthermore, the same study noted that people who ate the most whole foods were 26% less likely to report depression than those who ate the least amount of whole foods. However, we can combat these alarming trends through some grassroots approaches. There are many ways that we as consumers can limit our amounts of ultra-processed foods we eat, which will in turn create change more effectively than government intervention. One simple way to limit consumption of overly processed foods is to educate yourself on your own nutritional requirements and learn how to read labels. As a general rule, stick with foods that you have to cook and prepare yourself. Though it takes time out of your day to make these meals, you can do a weekly food prep in which you cook enough meals to last a week and freeze them in microwavable glass containers that are easy to transport. Another tip is to only shop the perimeter of grocery stores, which limits your choices to things that are fresh and minimally processed. As consumers, we sometimes feel powerless, but we can control what is on product shelves through our own purchasing power. For instance, if enough people stop buying these products, these profit-driven companies will move towards producing different items that will bring them profit. Rob Moody explains that companies that manufacture these unhealthy foods are not really subject to scientific scrutiny and policy change because they have deep financial institutional connections to scientists and policymakers. Therefore, instead of trying to reach the top members of our government to inflict change, who are generally slow-moving and held back by red tape and affiliation, we have to do our own research and create our own change from the bottom up. I will now conclude the speech by summarizing what we've discussed today. First, I discussed the negative impacts of ultra-processed food on human health. Secondly, I discussed ways that we, as consumers, can protect ourselves from these health risks and change the status quo through purchasing power. As famous horticulturist John Forty once said, "It's better to pay the grocer than to pay the doctor." Thank you.